Occupational therapists understand how the familiar and meaningful activities we engage in are important when someone has or is at risk of delirium. There are a number of ways that an occupational therapist might support patients with delirium, their family, and work with other members of the multidisciplinary team through and after a delirium event. Occupational therapists can advise on adapting the environment for somebody with altered cognition and perceptual abilities through consideration of noise levels, lighting, colour and contrast, having visual or written aids, which can all make a difference to someone's ability to sit up out of bed, to be able to listen to those around them, take part in their care and complete other daily activities like getting washed and dressed. Occupational therapists will often work with nursing staff and family to adapt the environment to minimise distraction, which is tiring for somebody with delirium, and to maximise their orientation and support for reduced cognition and high stress through having simple things such as clear clock faces, family member photos, and calendars which are kept up to date and in line of sight. Managing fatigue during delirium, often through a schedule agreed across the multidisciplinary team, can be essential to make everyday tasks more feasible for somebody with delirium, as well as optimising their sleep at night time, which can be done with the use of eye masks and earplugs. Their preferred restful activities during the day may assist with distress, such as listening to favourite music or their radio station. Through essential activities such as self-care, an occupational therapist will often recommend that familiar items are positioned within easy reach for patients and as safety allows. For example, a patient's own clothing or their toothbrush or their comb is readily available to them. As someone's delirium starts to resolve, mobilisation, assessing their risk of falls and increasing cognitive stimulation and challenge are ways that occupational therapy can support their recovery. We know that early occupational therapy has also been associated with improving functional outcomes at hospital discharge and with reducing length of stay. As someone recovers from a delirium, gaining confidence and reskilling in the activities that they need to do or want to do to leave hospital become very important. So this means a person with resolving delirium may be encouraged with an occupational therapist to become more independent with showering and dressing, practice being able to prepare a simple meal, and alongside their family, prepare their home environment, taking into account safety around physical or cognitive challenges that they may face when they leave hospital.